Hello everyone, and welcome to Itenniv's webinar on navigating immunizations in 5.8 and 8.3, presented by Jeannie Logue. We enjoyed the opportunity to meet many of you at the NextGen user group meeting this year and hope that you find this webinar interesting and helpful. My name is Chelsea Lukens, and I am the Marketing Communications Coordinator for Itenniv. I would like to take a moment to explain the process for today's presentation. First, I would like to mention that this webinar will be recorded. In just a few minutes, I will introduce our presenter. Jeannie will then share her knowledge and experience with the immunization module in 5.8 and 8.3, along with tips and tricks for your practice. After that, we will open the floor up to questions from you on the immunization module and how it pertains to your practice. We will answer all questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. Without any further delay, let's go ahead and get started. I'd like to introduce our presenter, Jeannie Logue. She is the Manager of Consulting Services at Itenniv and has worked hand in hand with the pediatric practice and NextGen as they went live on 5.8 and 8.3. She is recognized as a leader in the industry and a past speaker at many NextGen events. Jeannie, I'm going to go ahead and pass the microphone off to you. Feel free to get started when you're ready.
Hey everybody, good afternoon. Thank you for taking some time out of your day to discuss immunization 5.8 and 8.3. What we're going to discuss this afternoon is we're going to go ahead and cover why we went from a template to a module. Immunization setup and file maintenance. There's a lot of new fields in there that we have to complete. VFC versus private immunizations. Inventory maintenance in EHR, the workflow of immunizations, ordering and administering immunizations, and the immunization reports, or VIS documents, and some tips and tricks that we've discovered that have helped us through this process. The first thing we have is why the move to the module. The template was working great. We all loved it. To meet meaningful use Stage 2 guidelines and reporting, it was necessary for NextGen to move the immunizations over to a module. By doing that, we have to be able to generate the CCDA documents in a proper format, which is what caused the move over to the actual module. And the immunization registry submission requires an interface and successful submission for the entire reporting period, and many states are requiring the registration prior to the reporting period. So if you have not registered right now, start planning and coordinating that now. Version and hotfix is important with immunizations. So currently, the most up-to-date data that we've got is for the immunizations to be functioning properly for you right now. You need to either be on 5.8 hotfix 108 or 5.8 UD1 hotfix 69. In the file maintenance setup, we have what we call a lot of more fields that have to be completed for the immunization to actually function properly. We have vaccine orders or vaccine inventory, vaccine billing, vaccine relationships. Practice preferences has a new tab, orders immunizations, the VFC reason codes, and the VIS setup. File maintenance and the setup, the order list or inventory list. This is going to be important based on whether you're on 5.8 or 5.8 UD1 on what this is actually even called. So if you're reading documentation and you see vaccine orders and you can't get or you see vaccine inventory, it will depend on what version you're on. Each vaccine lot number has its own order and its own inventory list. And this is real important that we cannot combine the lot numbers. Cleanup and hiding of all inactive vaccines is also critical when you actually do if you've already converted to 8.3 and you've already done your upgrade. You probably already went through this practice, but if you're just starting this, when you go ahead and do the upgrade, it actually brings over all your inactive vaccines as well. So there is the cleanup in the file maintenance, and you have to hide all the inactive vaccines. Each vaccine lot is assigned its own location. And we have to complete the options tab on each vaccine order. So when we pull up the order in file maintenance, and whether it's your inventory or your orders, depending on 5.8 or 5.8 UD1, we have to make sure that all of the fields are complete. So when I said you have inactive vaccines in there, the inactive vaccines are going to come over where a status is either left blank or it's inactive. So all the vaccines that are active must have the following fields, which do pre-populate when you create these. They must have the status of active. They must have a CPT code attached to them. The CPT description must be there. A CVX code has to be there, and a CVX vaccine name. Now the vaccine name, you can pre-enter what you want, and here we have a Hep A, and then we have adult after it. And then the strength, the route, the expiration date, brand name, manufacturer name are optional. Your NDC number and your ID, your NDC ID, and your starting units and total components. The more you complete here, all this data then is pulled when you actually do the vaccine and you're given the immunization. It will all pull the NDC number and the manufacturer and everything for you in the EHR application. In the orders list, a little tip is after the vaccine name, if you add VFC or private, you're actually giving the immunization and you do your drop down. If it states VFC or private after it under the vaccine name, it's a real quick visual that you are giving a VFC vaccine or it's just a private vaccine. A couple of clients have really discovered that that has helped them out a lot. Under the location, each vaccine has to be a drop down and listed to a location, a specific location. If the location is left blank, when you go to find that inventory, when you're given the vaccine, you often cannot find that lot number if a location has not been linked here in file maintenance. The CVX codes are extremely important. Each vaccine has a CVX code, but many of them have multiple CVX codes. So they are supposed to uniquely identify the vaccines, but some of these have changed. So earlier versions of the KVM and custom templates were often missing the CVX code, which is causing a lot of unknown vaccines. So when you look through your inventory and your orders, make sure that all of them have a CVX code. And if you're unsure on what is the correct CVX code to use, go ahead and refer to the CDC's website, and I've listed that here. In file maintenance, under the setup in the orders or the inventory, there's a tab under there that we do not want to add additional lot numbers under the option. And originally, I think this was a goal to go ahead and list multiple lot numbers, but each lot number has a different expiration date, so you are not able to list your additional lot numbers here. And you also do not want to enter a vaccine admin CPT code unless you want this to specifically overwrite the default admin code. In file maintenance, another setup is every vaccine must be linked to a SIM code, and this is under the vaccine billing. And you can have multiple SIM codes, so if you want to create very specific VFC SIM codes, you can, and you would link both of them here, and then you have to state that one of them is the default CPT code or default SIM code. File maintenance setup and relationship. This is another new field that we have. The vaccine relationship, this is going to link all your CVX codes to the same vaccines. You can go ahead and review these. I have not heard of any problems or seen any problems with this setup. It has been coming out of the box pretty clean, and we've not had to make any changes to this. VIS setup in 8.3, all the VIS documents now can be loaded in the VIS setup. Much easier than it was in the past, and just go ahead and remember to load both English and Spanish. Under practice preferences, I stated that we have a new tab, immunization, under the orders module. This is another piece that's extremely important in the setup, and if pieces of it are missing, then there is issues on the back end in EHR when you're actually trying to administer the immunization on the right lot numbers. The first thing we need to do is make sure that we have the default registry. If you do not have your default registry loaded, you must request this through NextGen, and then you can go ahead and load your state registry. The default VIS print mode, you have the option of having it prompt you and ask you when you give the immunization to print it. You have the option of having it automatically just print once you complete the immunization, or you can click None, and then you can choose whether you want to print it or not at the time of the immunization is given. Under the categories, we have favorite categories. Out of the box, you're going to see a couple of favorite categories set up, pediatrics and adults. And then you can go ahead and set up your 4-month, 6-month, 9-month, 18-month categories. And then what you'll do is load your favorites under here so that when you click on that box, once we get in the application, you'll see when you click on that drop-down, you're only going to see the immunizations that are warranted during that time frame that you've chosen there. And the default vaccine schedule is loaded at the bottom of your practice preferences. These can be changed if you choose. Again, they are just the standard vaccine schedules. The VFC Reasons is another one. Until you have your registry loaded, you cannot create your VFC reason code. So once you load your registry, then you can click on the VFC Reasons, and you can go ahead and put your different VFC reason codes in here. And these fall under your master file systems. When we get into the application over on the EHR side, there is still some additional setup, but that is all what we do in the file maintenance. So we're going to map our vaccines that are unmapped immunization panels. When I say unmapped, the CVX codes that, again, came over that were the older ones or came over without one, they're going to show in your immunization orders as unknown. And we need to make sure that we map those. If you're not available to, if you do not have the ability to map them, again, check your version or your hotfix, because this was another utility that came out at some point around August. Inventory management, how do we manage our inventory once we have it set up? All set up in the file maintenance is going to carry over to AHR, and you're only going to need to add any brand new vaccines in file maintenance prior to adding them to your inventory. So once you've set up your inventory in file maintenance, unless it's a brand new vaccine that you're giving and you never have given before in your practice, you should not have to go back to that setup in file maintenance. This is the NG utility to map them, so any of the records that do not have an exact match during the upload are going to show as unknown. Just go into System Practice Templates, pull this utility, and then it's pretty self-explanatory on how you map the different immunizations so then they all go into the correct CVX. To create any new inventory that comes in, you're just going to, a quick tip is we've determined that if you just open an existing inventory and just update the lot number, your expiration date, and your starting units, instead of clicking Update, you just go ahead and click Add, and this will enter a whole new lot without having to enter all the additional data that's there. Workflow, order, and administering the immunizations. We're going to go through how to order it through the Orders module in the Immunization tab, the allergies, how to complete an order, whether you task, save, or send it, how you actually administer the vaccine, the VIS documents, the VFC versus a private, what we do with wasted vaccines, and what we can do with exclusions. Under the workflow of immunizations, you can go ahead and access immunizations directly through your Orders module. Many clients have decided to go ahead and just create a sub-navigation bar, which makes it really quick and easy to get to your immunizations. You can review new immunizations required and just click New Order. The diagnosis codes are set up with the vaccine, so no diagnosis is required when ordering the immunizations. These are all linked from the back when we created the orders. Once you're in the actual Orders module, you can choose the vaccine you want to display. You can utilize the pediatrics or the adult, or we talked about the practice favorites that you can create. So you have your show favorites. You can look at them by category, and then you can always do a search all if you want to see all immunizations that you have in the system with a lot. The vaccine you choose will then display at the bottom of the order, and the diagnosis will default to each of the vaccines. The review allergies will immediately launch every time an immunization is ordered. Now, this can be disabled if the practice desires within practice preferences, but it is a practice preference, so if it is disabled, it's disabled for all physicians. Once you actually complete the order, it will ask you to either print, save and send, save and task, or just save. And depending on whether you have the VIS to go ahead and automatically print or have the pop-up, this is where if you have it set to none, you can just click on Save and Print, and then you can immediately print the VIS. Save and Send will send the immunization information to your registry. Again, double check whether you've got your auto send through the interface set up and you've worked with your registry to be able to start receiving the immunization records. Save and Task, you can create a task for a work group and go ahead and task this over to somebody to come and give the immunization. There is an issue right now. It does not list all staff members like all other tasking does in EHR, so you do have to create task groups to be able to choose from the orders module. And then save is only going to save the order and nothing else. When we get into administering the vaccine, within the orders module, they just go ahead and click on the order, and the order that was placed is now viewed, and you can just go ahead and click directly on that order. And at this point, you can also print the VIS, or you can click on Document as Given if it's already been given. Now, depending on whether it is a VFC or whether it is a private immunization you're given, once you actually click on VFC Reason and choose one of your VFC reasons that you have built in the back and file maintenance, this automatically then goes to your VFC lots and will look for only vaccines that have been linked in file maintenance to VFC. For private insurance, you will leave the VFC reason blank, and you can enter your funding source for either private or for VFC, and that's not going to affect or drive your lot numbers. So when you're going through this, if it is VFC, you have to choose your registry first, drop down, choose your VFC reason, which then is going to tell the system which lots to choose for you, and then your funding source. Once you go ahead and choose that, you will get your drop-down boxes, and it will show your lot numbers. This is where we stated that you choose a lot number. If you free text any lot number in, it will allow you to do that, but it will throw your inventory off. So if your lot number is not available, check your inventory and your lot numbers in file maintenance. If it's a VFC and you're not seeing a VFC, then again, go back and determine whether you've entered your VFC reason or not. And this is where I said if you want to go ahead and put VFC after your name of your actual immunization, this is where the visual will actually give you that it is VFC or it is private. All data is going to be pre-populated in file maintenance once you actually choose that lot number. You can enter the site, and this list can be altered by a SQL script. So once you enter the site of where you're given the immunization or the vaccine, it's a long list of about 68, I think, choices of where you can give the immunization. We have worked with NextGen, and there is a SQL that you can get to remove all of the sites that you're not going to be used, so you have a nice small, compact list of sites to choose from. We'll check completed. You have options to mark partially administered, excluded, refused, or not administered, depending on what immunizations you're giving and whether it is a complete immunization given. And then once you do the completed, the order will change from ordered to completed. Now, if you do have a waste vaccine and you need to record that, you're unable to give it, the child didn't cooperate, you're going to go ahead and highlight the vaccine name that you're documenting the waste. and then you just document it as a wasted vaccine, which will keep your inventory up to date. So anytime you've already drawn up the vaccine to give and you have to, trash it, you're going to go ahead and make sure that you do go ahead and click on Save Waste to keep your inventory up to date. You also have the ability now to edit a vaccine. Securities are required for that. So if someone needs to edit a vaccine and they don't have rights to do it, you'll need to go to System Admin and make sure that you give them security rights to update or edit a vaccine record. You would just click on the vaccine you wish to edit, click Historical button, and you can update the vaccine. Exclusion series complete. If your immunizations are showing up as past due, but you've determined the patient does not require the vaccine, you will need to complete the series. You can utilize that by the exclusion tab, and then the series will show as complete, series complete. I've had a lot of questions on, well, that's really not, I don't want to complete it, it wasn't complete. If you can't enter it historically that the patient has already had the vaccine historical, that's what you're going to enter it historically, but you just need to clear it off on past due. The patient is no longer age eligible for that vaccine. Right now you have to complete the series to at least get the past due off. I know NextGen was looking at a different way to do an exclusion here, so it didn't state series complete. The immunization documents reports, you want to make sure that you're not using the KBM document. There is a crystal report provided for 5.8 hotfix 87, so if you're not up to hotfix 87, again, the hotfixes are very important with the immunizations. Review the vaccine summary report. It is no longer in a matrix grid format that it was with the template, so just make sure you take a look at that. And go ahead and review any documents that you may have set up to pull immunization information, school forms, any crystal reports that you've created from the templates that are pulling immunization records. These will need to be reconfigured or they will be incomplete. You may have it pulling some information from the orders module and some information from the template, so you'll need to have all of those special forms that you had created looked at and probably reconfigured. The VIS documents, they are included in 5.8 UD1 and do not need to be downloaded, but do need to be moved over into your distributed reports, and I've given you the link there. Go ahead and you just make sure that you do move all Spanish and all English. Make sure that each vaccine is linked to the correct VIS. And go ahead and adjust your practice preferences to either prompt to print or do nothing with a VIS document when a vaccine is ordered. We talked about that in practice preferences. There's been quite a few issues with vaccines that have been resolved or unresolved, so I went ahead and listed out here a couple of the common questions is, my vaccines are not lining up. I can't administer immunizations on locked encounters. I can't edit a vaccine because there's no location ID. I can't edit a vaccine because it does not have an encounter ID. All of these issues should be fixed if you're on 5.8 hotfix 108 or 5.8 UD1 hotfix 69. If you're on those applications and those hotfixes and you're still experiencing these type of problems, you'll need to open a ticket with NextGen and see what's going on because most of those issues have now been resolved. A couple of other tips and tricks that we found working through this was if in practice preferences you have an immunization that's missing a diagnosis code and you've linked it in file maintenance and it's still not showing up here in practice preferences, you'll need to contact NextGen. They have a script that will fix this issue. You can easily delete a vaccine that's ordered in error. You're just going to highlight on the vaccine and click delete. A couple of other tips that we had is make sure that you do review and adjust your age group preferences, review the CDC recommendations, and make sure that they're appropriate for your practice. And that's under Practice Preferences, Order Module, Immunization under the vaccine schedule. You can go ahead and make those changes. So when we're looking at the ones that were past due, If that's not the schedule that your practice is currently using, you can go ahead and alter that so it doesn't show past due for your practice. Prior to the 8.3 go live, clean up your inventory and file maintenance. Again, if you've not went live on 8.3 yet, when you go ahead and do that in test, we've had some practices build their entire inventory in test, and then write a simple SQL script and copy test to prod for go live weekend so they don't have to rebuild it go live weekend. Test your database, run simple scripts as we just talked about, and test to prod. Make sure that you have only one CVX code used per vaccine type. If you do the drop-down and you're looking for a lot number and it is not showing up, often we've went back into file maintenance, we've looked under hepatitis, and we have found that there's multiple CVX numbers in there, and we've had to rebuild that inventory so that only one CVX is linked to that immunization. And then remember to add your order list to your vaccine favorites and practice preferences. There is quite a few new white papers out from NextGen as well right now. There's an overview of changes to set up for the Medicare Q codes. There's some options for EHR orders module. There's an immunization setup for creating vaccine inventory for multiple locations, as well as one for NDC billing. So I've listed all the white papers that they've came up with here lately that are going to help people get through this immunization challenge. All right, I see that we have a couple of questions that have went through, so I'm going to go ahead and kind of jump through and look at the questions. And if you have additional questions, keep sending them through the questions box, and we'll try to get all these answered. The first question is, there going to be a fix where, go ahead, Chelsea.
Oh, you go ahead. If you see them, go ahead.
I can. Are they going to fix where and when adding a vaccine to your favorites and practice preferences, the vaccine name claims overwrite, and now we have to go back on the back end and update it there? The question is over in file maintenance, there is no ability right now to change that name. I know that from what I have heard that they were looking at that, but currently there is no way to change the vaccine name that's over there. Are you able to sort on the EHR side with the latest upgrade? Not able to do this at this time. Very difficult to find vaccines. No, there's no ability to sort, so building the smaller category or the smaller groups is the best way right now that I have found clients to be able to find the vaccines easily, is to create your subgroups and practice preferences, your smaller groups, and then drop down by your categories and find your vaccines that way. How is the best way to identify historical vaccines administered outside the organization? Historical vaccines, honestly, with that one, I know that there's a way to enter them, and I think they're still listed as it looks like they were done in-house versus that it was done outside from another practice. So I don't know that we have a clear-cut answer on how you can identify quickly that it was entered historically. Can a vaccine be linked to a standing order? Not to my knowledge, no, because it's in the orders module. It has to be ordered separately within the orders module. The question is, if we build this in test, we must run a SQL script to copy this to prod. If you have not upgraded to 8.3, when you do your upgrade to 8.3 in test, and you look in file maintenance at all your inventory, and it brings over all of your inactive inventory, when you clean that all up, yes, if you do not write a SQL and copy that over to prod on the weekend, you will have to do all that cleanup again. It will not hold what you clean up in test. Because once you do the 8.3 upgrade in prod, it actually does exactly what it did for test. It brings over all the inactive inventory, and you have to do that cleanup. So you have two options. If you haven't upgraded, you have two options. Once you look at all the inventory when you do the upgrade and test, review that, and if it is quite a big project is what we've seen, then the best thing is build it in test, write a sequel, copy that sequel over to prod on the weekend of your upgrade. Do we have to add the NDC in the SIM library? Most of your NDCs should be already into your SIM library, linked to your SIM as well, but you still want to build it on the inventory. At this point, they weren't actually talking to each other, so we have built them in the SIM library, and we have built the NDC as well in file maintenance under the immunization. Okay. Question came through on not by sorting the vaccine and premises on EHR side of the inventory, possibly to review. If you're ordering your, from my understanding of the question is, if you're ordering your immunization, and when you're ordering it, you're getting basically the show all, so you're seeing all of your inventory. If you break those into smaller categories on what you're ordering, then it's a smaller list than just show all, and you have to go through and sort and find which immunizations you want to give. How can we update or manage the CVX list? Again, I would go on the CDC website, pull down the CVX list, and when you build your inventory and file maintenance for the first time, you would determine which CVX code is correct for hepatitis. Go ahead and make sure that that is the CVX that's linked to your inventory for the hepatitis, and then any new or additional inventory you have for different locations, they all have to have the same CVX number. Oh, okay. Well, I'm sorry. I apologize. I misunderstood the one question. On the inventory ordering, you want to be able to sort it in an alphabetic order or sort it in group. No, there is no way currently. They have added that you can see the location there now. They've added that you can see the dose there, but that list that's in file maintenance. So the question was, how can I break it into smaller groups? And the inventory we're talking about in file maintenance, not the inventory in EHR when we're actually giving the immunization. So in file maintenance, your inventory list is an extremely long list, yes. There is no way to break that down into smaller chunks. You can sort it alphabetically. You can sort it by practice location. Make sure that everything that's inactive in there is hidden. Otherwise, it is even longer than you want it to be. So you will have to go through and hide anything that does not have a CVX link to it, and any of them that are inactive. Once you hide that, you're only going to be looking at your active inventory, and that's going to make that list a lot smaller. Will the presentation document be around for available for download? Chelsea, will this be sent out to everybody?
If you want it sent out, please shoot Jeannie an email here. Her email is showing on the screen right now. Also, we will be posting a copy of the presentation to our YouTube site, and we'll be sending out a link to that on our Facebook page later today. So if you want to check it out or show it to somebody else, that'll be an easy way of doing it as well. Perfect. And I've had a couple of people say that it'll be easy to explain the question to me. Absolutely. My phone number is on here. My email is on here. If you want to shoot me a question directly to my email, I can set up a time and we can kind of talk through the inventory list that we were just talking about. Not a problem. We can pull it up and look in the application and kind of walk through what we're talking about with that. There was a question that I've entered the influenza vaccine favorites list, but it did not group with the other influenza vaccines on the Create New Immunization Order screen. How do I fix that? That one I'm going to ask that you actually send that to me, or we do a call and I can take a look at it, because I need to determine exactly where it's at and where it's not showing up at. So if you can give me a call on that one, Sally, or shoot me an email, we can take a look at that one as well. We're going to hang out here for a few more minutes if anybody has any other questions they want to add. Otherwise, we also will be following up with an email later today, so feel free to let us know if you have questions then as well. Like I said, we'll be putting this on YouTube. The link will be on our Facebook page. While you're at it, go ahead and like us on Facebook.
Well, and hang in there. Immunizations is actually, as you can see, what hotfix are on for both versions. Immunizations has been, changing faster than we can keep up with it. There has been, new fixes with every hotfix on this wasn't working, and now it is. It is much, much better than it was back in June, July. There are still a few issues that, NextGen is working through. So we can kind of, keep you guys up to date on any time we hear that a new hot fix is coming out that's going to resolve an issue that we've had with immunizations.
It looks like there's another question in here. You mentioned not to use the KBM vaccine document. Use the Crystal report instead. Just for reference purposes, why are we not supposed to use it?
From NextGen Direct, that they stated that it's because with the move from the template to the module, the KBM vaccine document is pulling the document from the template, and it's no longer able to pull it from the module, so you will have inaccurate or incomplete documents. It will only pull your historical data. It will not pull anything new that's been put into the module. So I have looked that have printed in printed school forms, and it looks complete because it's pulling all the historical data. But if you go back and actually really look at the document and an immunization was given within the last, since the module change, that information is not on the report. So just take a look at your documents when you're printing them. Make sure that historical and current data is pulling on any document that you've created to pull immunizations.
Jeannie, do you have any other advice for anyone out there? Any last things to share with the group before we finish this?
Nope, just hang in there. Hang in there, ask questions. If you're really struggling with something, again, there's a couple of different, like I said, SQL scripts. If you're missing diagnosis codes, make sure that you're not. There are things that we have determined are just true issues, that there are SQL scripts out there that NextGen can, quickly, get on your system or send to you to have somebody run that will clean up some of the issues that people have been having that are just causing, most of the headaches.
Any plans to have webinars in vaccine relationships? We do have some webinars coming up here. We're going to be doing one on population health management, ICD-10, it's back, minor medical records in regards to the patient portals, and meaningful use audits. I don't believe that there's any plans in the works to do ones about vaccine relationships, but there's always a possibility. We'll be emailing every week when we have these webinars, just as we did for this one. And we'll be sending those out roughly a week ahead of time. If you were on the list to be invited to this one, then you'll be on the list to be invited to the next ones. If you weren't on the list and want to be, then shoot us an email. We're happy to add you, of course, and we also do post them on our Facebook page again. Looks like 2 more questions. Jeannie, any reference materials you can recommend?
The ones that I gave to you that were actually the white pages on here, there are several, again, there's several new white pages out here that, depending on whether they pertain to you, whether you need the Medicare Q codes. I've reviewed most of these. They're pretty straightforward. That's the best documentation that I'm finding right now. And again, just making sure that you're on the right hotfix is critical. Because if you're looking to set this up and you're not on the most current hotfixes for either one of the applications, 5.8 or 5.8, you do one, you will be missing parts that are critical for immunizations to work.
Another question, will NextGen provide the SQL script to copy from test to prod for free?
That one was not written by NextGen. That one was actually written by by us because we didn't want to spend time actually doing that. Most of the sequels with NextGen, you can reach out to them to see. I know they are aware many of their clients are using that because to clean up your test environment and to hide all the immunizations that are inactive, it's not a weekend job. It is a very labor-intensive job, and then to create the entire inventory that you do not want to have to do at go-live weekends. So if you are hosted or NextGen direct clients, I would reach out to them, talk to them about it. It is a fairly simple SQL. If you know anybody that within your organization that can write SQL, it's pretty much a copy. I say simple SQL. But that one was not, that one we did not receive directly from NextGen. That was one that we created because we did not want to spend the whole weekend rebuilding our inventory.
Just as a reminder, next week's webinar is going to be Wednesday at 11 a.m. Central Time, so that'd be 12 p.m. Eastern Time, and it's going to be on population health management. Okay, well, it looks like that's it for today. We look forward to chatting with you later and hope that you join us next week for the population health management.
Thanks, everybody. Have a wonderful afternoon.
Thanks so much. Have a great day.